Okay. So just gonna check. Okay, so we're good on LinkedIn, Facebook, YouTube, Twitch. I'm just gonna check that we're also good on Instagram. Okay, we're good on Instagram as well. All right, hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Laurence Doan, and today we're joined by Dr Andrew Sproll. He grew up on the Central Coast, New South Wales, and he was a dental assistant for 15 years before becoming a dentist. He practiced as a general dentist and principal/owner of a dental practice on the Central Coast, New South Wales. He has a special interest in children's dentistry and orthodontics, in addition to all other aspects of general practice dentistry. Dr. Andrew Sproll, welcome to the show.
Thank you very much, Laurence. Thank you for having me.
So full disclosure, me and Andrew, we've met before as colleagues as the ADA New South Wales Recent Graduate Committee.
Yep.
And prior to that, he was actually on the ADA Vic as a counsellor and director. So are there any differences, would you say, in between the Vic and New South Wales state committees for the amount of time that you were in it?
Unfortunately, I was only in the New South Wales sort of committees very briefly this year, and sort of due to moving back home to the Central Coast and just sort of focusing on clinical dentistry and buying into practice and stuff. But I don't think there's really a lot of difference between very small amount of exposure to New South Wales committees and Victorian committees, other than to say I'm hoping to get back there next year and get on a committee again. So,
and is there a difference between being a counsellor versus a committee member?
Look, it's a really interesting question. I think, essentially committees, I guess you're advocating for your community, and if you're on a sports committee, for example, you're reaching out there to try and get members and the community involved, or the dental community involved. I think essentially streamlining down from counselling, you're literally an advocate for ADA Federal as a whole, I guess. So regardless of whether you're on a committee or on a sort of a council role, I think we're all pretty much doing the same things to help the dental community and professionals. I think the main difference is like being a counsellor, and if anyone ever gets the opportunity and is interested in doing it, it's a fantastic role. And I think, in summary, to quickly summarise it, otherwise we're here all night talking about ADA stuff, is that essentially it gave me a voice, and I've usually got quite a voice, and I like to have an opinion about things. I think being an advocate for like the demographic at the time, being a young graduate dentist at the time, not young as in age young, but being a mature age student or mature age graduate, I think that was the best part about actually having a vote to sort of help lead the way that the profession might go with that representation of an association. So.
Yeah, so I guess like if you have an opinion and you want to make some contribution, definitely join in and to voice that. Otherwise, sometimes it might not be heard.
100%. I think any, council or committee branch, different committees, it's unreal. It's actually meeting people in the profession that are like-minded, and interestingly enough, meeting some different specialists and some really cool people that lead you on a path of different things and stuff as well. But I think if you've got a little bit of time and a little bit of interest, and you want to get out and meet people in the profession, go join a committee. I believe ADA New South Wales at the moment has just put out their new ad to join a committee. So now's probably a bit of a time for me to give a plug, even though I'm not on ADA New South Wales at the moment. But yeah, do it. Go for it.
So let's dive into your CPD or dental journey. So how did that develop into a special interest in children's dentistry and orthodontics?
Yeah, well, it's a bit of a long story, again, in the interest of keeping it brief. I think, I was a dental assistant for, 15 years at my early part. And, I started off being a dental assistant in a public clinic in Hornsby. And, then sort of reached out and started working at the Children's Hospital Westmead, and then for a private pediatric dentist. And I just bloody loved working with kids. It's probably the most rewarding experience for me. General dentist, I love working with adults as well. But then, I studied psychology, then got into dental school and finished dentistry. Spent, the first couple of years with a really great mentor, actually. But it wasn't until I sort of moved home to the Central Coast and just thought to myself, what is it that I really like about dentistry? And, there's always that conversation that a dentist will graduate and then go, oh, maybe I want to be a specialist, or maybe I want to do these things. For me, it was just about realizing that there's a lot of young families, a lot of children around on the Central Coast, and to be able to be actually offering a service that I just love doing. Like, most days I go to work feeling like just loving my job. So there was a lot of influential people and roles within my work as a dental assistant and the places that I work. There was heaps of people that inspired me to do this. And then literally attacking CPD and looking at ways to better my education in doing what I'm doing to make sure that I'm doing the right thing. So that's sort of the inspiration for getting there. I'm not really sure that I'm there yet, but I'm definitely doing what I want to do. So.
Yeah, well, I mean, let me try to get this right. So basically, you were a dental assistant in the public, and then somehow you aligned yourself with a pediatric dentistry kind of clinic. And then did you kind of continue, because were you a practice manager at one point as a specialist?
Yeah, so there's little boxes to tick on my life here, but there's so I was a dental assistant, and I worked in the public health, as I said, and then sort of the Children's Hospital at Westmead and Westmead Hospital. And then one of the pediatric dentists who worked there, I'm pretty sure I can say her name, Philippa Sawyer, bloody marvelous person. She gave me a really great opportunity to come and work with her in a private practice and set up her practice, and then ultimately become the practice manager. And I think all this time, every dentist that I've worked for, and so there's this multitude of dentists, so getting this awesome picture of how to handle different situations and all this sort of stuff. In the background, all I want to do is be a dentist. And anyway, I guess ultimately she was the last person that really just pushed me to get there. So I think it was sort of private dentistry and private pediatric practice, and then even I moved interstate to Adelaide, and then I'm working in pediatric dentist over there and stuff. So I think pediatric dentistry or children's dentistry, I'm not a specialist, children's dentistry for me was just the go-to, because I actually really enjoy it. And there's, I get more satisfaction out of seeing a kid come back for their checkup in a really positive way, going, Andrew. In the same way, some people might see this beautiful DSD of, 6 to 6 crowns and going, oh my God. And I'm like, oh, look at those cute kids. Yeah, that's pretty much me.
Right, yeah. And then, so basically what you're saying is like you kind of fell into it, and then you kind of realized you really liked it, and it just kind of resonated with you, and then you had this opportunity that kind of led to the next point. And then how does this psychology degree kind of come into all of that? Because Look, if I'm being honest, psychology was sort of a stepping stone to become able to apply to a university to get into dentistry. So initially psychology was a step to get at some sort of undergraduate degree so that I could be competitive with the old 18-year-olds. But it was an awesome stepping stone, because it gave me some really beginner's tools. And if I still think back to some of those principles, like I still use them in the surgery with like a really difficult child, or controlling the parent, or managing how the parent might behave in that appointment. So I think it was actually a really good tool to have got. Right. So as much as we don't really ask for tips and tricks, but what was it that you have found that was helpful? Because you're kind of alluding to it, but...
I'm just sort of saying that I think, most of the time, a lot of the troubles of getting a child patient to actually do something in the chair is, obviously their behavior, so behavior management techniques, but also controlling the environment, because really the kid can only listen to one person, and that person is the person, giving the injection or doing the stainless steel crown, whatever it is. But then it's also learning how to manage the parent in the background, because let's face it, right? It's a lot about the parent on the end of the chair, and it's not going to hurt. It's not that sharp, and so yeah, just little techniques in ways to manage that. So, and that was like partly psychology, but also watching these fantastic specialists do it day after day after day. So credit is mostly probably to them, to be honest.
Right. And so you're completing this, and you're preparing yourself ready to get into dentistry, and you get in now at this point, and then you go through it. And obviously, at the time when you're going through it, there's not pediatric dentistry isn't a large focus within the course, right? And so you graduate and you come out, and you've tasted all these other different types of dentistry as you would when you're studying. And then how do you say to yourself at this point that you still want to stick to it and not maybe want to deviate to something else? Where do you start picking your CPDs, and because you've come out, and are you looking for practices that specifically focused around pediatric dentistry? What's your mindset?
It's a big question, Laurence. No, but no, I 100%. I think in the back of my mind, even at uni, I really like student clinic, and do I think it's particularly well taught? Probably not. Do I think there's a big emphasis on as a dental student? Probably not. Because I feel, it's always sort of put back to the oral health therapist to manage children. I appreciate that children's dentistry is not for every dentist. So when I had all these great things, and I really particularly like minor, like oral surgery things like extractions and that sort of stuff when I first graduated. And so I was working at a practice in Geelong, and one of the best parts about that was, this is my first ever job, and the principal dentist was so good at helping you with ethical dentistry, right? So teaching you the basics about what's the right decision to make by the patient and what to do for the patient. So anyway, so I started doing this thing, and then I'm like, oh wow, do I really like doing crowns? Oh, do I like doing extractions? And then I guess there was more and more children coming through the practice. It sort of just started leading me to go, if I ever specialize one day, would I specialize in pediatric dentistry? And then when I moved back home to the Central Coast, I got that opportunity because, when you're starting to build your book, right, you're seeing lots of families, checkups and all that sort of stuff. And then I was just seeing the fact that, there's only one pediatric dentist who comes to the Central Coast, and, I was starting to refer patients out for GAs and whatnot. And, there's a waiting time, or the patient couldn't get in to see them. And I'm like, hang on, I've got this skill and I really enjoy doing it. So why not investigate that avenue? So CPD wise, when you're talking to a parent about taking a child and doing the treatment under general anesthesia in most cases, you better be knowing your stuff about how to put a stainless steel crown on, when to exo, permanent molars, how to do a pulpotomy, what the prognosis is of doing a pulpotomy. And so I on the CPD front, there was some really great free CPD on ADA from Juliet Scott talking about pulpotomy, stainless steel crowns, and taking you through some cool footage about that. So those sort of things are things that I like doing. But then it was like I was in GA extracting primary teeth, and no one's putting space maintenance in. There was all these consequences of tooth movement and all that sort of stuff from early extraction. So that sort of got me down the ortho line. And then so basically all my CPD now is just sort of being based on orthodontics, really, like GP ortho. And just it's an awesome complementary part to what I do with ped stuff. So, yeah.
Right. So you basically came out, you found a practice, and coincidentally it is a very ethical kind of boss that's trying to teach you that kind of approach, and then you find yourself somehow growing with more kids as your clientele, and that happens, and then you end up moving back to New South Wales, and then at that point you're also doing the same thing again, and you're still applying the same kind of teachings and learnings, and you're still getting more of these kids. And then at this point, you're kind of, and you can correct me at any point if I'm wrong, but at this point, you're starting to pick more pediatric dentistry in terms of CPD to pick from, and you're looking on ADA. Are you looking anywhere else, or?
Yeah, I think one of the other things, there is, not a great lot of CPD out there for peds and children's dentistry honestly. So what I sort of did was became a member of ANZ SPD and IAPD, looked at sort of the specialist associations or societies, and they let you have general membership for a general dentist. But they've always got some awesome videos and stuff on there that you can actually watch. They sort of open their research papers and all that sort of stuff. There's no real difference to joining another specialist
study club.
So I get my information from there sort of, so as well. So, but yeah, it sort of is what it is. I mean, you learn these techniques, but also just learning about and sort of watching people do it online. The other thing is too, is, you know, spending time with specialists. So I think an awesome part of my journey of being a dental assistant and actually wanting to be a dentist was I was really enthusiastic about watching them and learning what they were doing. So I got quite a lot of insight just from watching these guys day after day after day, and 15 years of it. You know, like I could see how a stainless steel crown was done and that sort of thing. So
yeah,
a lot of it's finding membership with different societies as well, because they've got the goods. But
I think that's an interesting point because a lot of graduates, when they graduate, they don't realize that there are these study clubs outside that are specialist study clubs that you, as a general dentist, can go and attend, because they may not actively promote it or whatnot. And so, yeah, graduates definitely, if they have a particular interest, can go to these study clubs.
Yeah.
When you're attending, you know, pediatric dentistry CPDs, one of the things that I feel graduates might feel a bit of a hurdle to get better in is that they're an associate. They're an associate in a practice, and they're talking about stainless steels, they're talking about space maintainers, and then they're in a practice where they don't have these materials, right? So, I mean, what would you say to that?
So I would say, like, you know, if you go back to uni and, you know, the principles for doing a stainless steel crown, for example, you know, if the principal is not doing stainless steel crowns, like literally the technique is much faster than doing like a GIC or, you know, with a matrix band and whatever. And it's a longer lasting restoration, and it's the restoration of choice. So I would say, you know, bearing in mind, understanding what it is like to be a new graduate and asking for things, I would say approach the principal and just say, look, this technique is proven, it's really good. It's actually, a kit of stainless steel crowns is really not that expensive in comparison to, you know,
4 or 5 GAC capsules.
Yeah. It's like, you know, I think, you know, as a new graduate, you're not sitting there asking for things day after day after day. Like, oh, you know, I want steric blocks. I want, you know, you're getting in and trying to be the best you can. But also, just don't be afraid to have a conversation with the principal dentist and just say, hey, you know, I've heard these are really good. I'd really like to do it. Do you have much insight into them? Why do you prefer doing, you know, GICs with matrix bands that fall out 6 months later? Or, you know, what, you know. But I think don't be afraid to ask, and especially, you know, there's heaps of stuff out there on how to do a stainless steel crown. Search it on Google or, you know, but don't be afraid to ask the principal, but also maybe sort of talk about the reasons why you might want to do it. So, you know, a definitive treatment option, and you're trying to do the right thing by the patients. Maybe it's that the principal just never done stainless steel crowns and just goes, you know, because, you know, most dentists I talk to don't do a lot of them anyway. So they're sort of like, mesial slicing, you know. But it's actually, you know, we're all running around doing, you know, Emax crown preps and stuff. But this is like a piece of cake. But I think don't be scared to ask the principal. Don't be scared to reach out and say, I'd really like to try and do this. I think they're a lot more receptive than what we think they are.
Yeah. I guess have an open dialogue, and, you know, I guess if you're at a point where it is feasible, then maybe get it, and then again have another dialogue with the principal about how that, you know, remuneration kind of goes.
The other thing I was going to say is you've got that potential of, I'm sure there's pediatric dentists in your area. They're pretty much everywhere. Why not go and spend a day with them and learn and watch what they do? Like, you know, ask them if you can go to GA with them and watch them place a stainless steel crown or do a pulpotomy. And then you sort of geared up, you know, right? You go back to the principal and say, this is awesome treatment. So yeah, I don't be too worried about asking. It's not like you're asking for a prime scan or something like that.
So, I mean, at this point, okay, so you're you're becoming more comfortable within pediatric dentistry, and then now you decide that, hey, I'm seeing patients that are having these ortho issues as well, having to do space maintainers, but I really should dive into orthodontics because it's, like you said, complementary in regards to that. So what do you decide to do at this point to learn more about it?
Yeah, literally, it's sort of, I know there's like a few prominent Australian courses, and so I'd sort of looked into those. I think one of the biggest challenges of new/recent graduates, or not long after graduating, is you're trying to earn an income. And so you're going, $30,000 for a course, bloody hell, where am I going to pull that from? I'm trying to buy a house or whatever. So initially I was sort of looking for probably what I could afford at the time. But then I was literally looking for something that might have information on dentofacial orthopedics and, growing in the mixed dentition and malocclusions, but then also full fixed appliances. Like, bearing in mind, I never wanted to be, I wanted to be a dentist doing general practice dentistry and not sort of stepping outside the realm that a specialist should be treating, for example. So what I wanted to do was find CPD that made it very clear to me what is stepping outside that boundary and when a specialist should be seeing the patient. And so then I just started locally, and I did the vital orthodontics for dentists for ADA New South Wales, the CPD centre, and brilliant. So that sort of got me started, inspired. Like, I was like, far out, I can be doing these things. And it was very hands-on and very full-on days. There were long days and tiring days. And so after I'd sort of done that, I thought to myself, I can invest 1 year in learning about this. Surely that will give me the either A, confidence to keep going, or it's going to tell me to stop. So, or I'm just going to bloody hate it and then just, haven't lost tens of thousands of dollars. But and actually it was the kickstart I needed to actually go, I really like this. I can incorporate this into my practice. I want to do more. So then that's sort of why I'm concentrating on more ortho now, because I want to be good at what I do, but also know my limits. So yeah.
So are you saying that, were you doing tasters on like weekend kind of courses first, or was it that you're like, no, I want something a bit more intensive, and that's how you decided to pick it?
Yeah, I think tasters is probably a good way of saying it. I mean, there was always like local specialists talking about impacted canines and phase 1 versus phase 2 treatment, and I was like, gosh, this is cool. So those tasters were there, but then it was a case of what can I do? How can I incorporate that into what I'm actually offering the patient that's not sort of detrimental to them, I guess. So that's what made me start looking for, I'm going to invest more money in my education, and I'm going to look for something reputable, and that's something that sort of addresses where I want to start. And, for example, the ADA course was absolutely brilliant. I learned so much stuff on it. And day one, it is literally, this is how you put a bracket on the tooth. So it was actually really good hands-on, because you're like, wow, this is cool. Oh my God, this is a bracket, blah, blah, blah. But what it sort of did was missed a little bit of the foundational knowledge, or the academic side that sort of gets you started on craniofacial growth and understanding of malocclusion and how it sort of starts. So that's where I was like, I don't want to just be putting braces on and, getting this awesome thing I can put on Instagram and go, oh, wow, look how good I am. It was more like I needed to understand what it is that I'm doing. So this particular course I'm doing now is ticking all the boxes, and absolutely loving it. And so when I was looking, I was literally looking, as I said, I know there's courses in Australia, and, probably my next journey will be taking on one of those courses. The reason why I've sort of taken on this course for the purpose of talking about it is literally for the fact that, we were just talking earlier, Laurence, is that the beauty of this course is that it is an online course for the most part. So all the didactic component is sort of 4-hour lectures a week. And, I can do that. They're pre-recorded. There's a live session. Obviously, everyone overseas can do it when I'm asleep or whatever, but I can watch it at my own leisure, take my own notes, and they've sent out this awesome practical package that's got for Sarco models and all this sort of stuff, and you've got to actually do the exercises, take a photo and email it to them, and the feedback is incredible. Like, whoever thought that I could get so much feedback on the angulation of a bracket? But this is the best part about learning, right? So yeah.
Yeah, well, yeah, I mean, because like I was going to say, like, for a lot of graduates, they think about, there's so many different courses, how do I pick it? And like you've said, you picked this one because, one, I mean, you already had some practical learning already, but there was that missing theoretical knowledge that you wanted to dive into deeply and more structured. And then so when it came to picking one, you had to find something that kind of suited what your lifestyle was at the same time as well, to complement what it was. And you found this online one particularly helpful because I mean, even though it's online, it still has, like you said, a didactic component to it as well.
Yeah, it has the didactic component. And so the way I sourced this program out was that to sort of suit my life and what I could commit to. And so I knew that every Sunday I could spend half a Sunday studying and all that sort of stuff for a period of time. But what I was also looking for in a course, and so no one had mentioned to me about this course, right? So this is at London Dental Institute. It's a postgrad diploma of ortho and dentofacial orthopedics. No one had mentioned this to me. I'd never heard about it. I'd never seen it advertised on social media. But I'm bloody glad I looked at that website, because I feel like I've struck it lucky with the education component. Like even though I'm logging in on a Sunday and listening to the lecture and making some comments, people are flat out submitting their cases online all day. There'll be about 5 or 6 new cases, and the lecturers are straight onto it and engaging everybody else. What do you think? Could this, that's the best part. So I'm kind of, disappointed no one else knew about it, because I don't think many people in Australia do it, but...
Might be out now.
Yeah, I mean, go for it. Hopefully I get an A. No, not paid by them either. No, I think sometimes, dentistry is sometimes a bit about gut instinct and stuff like that. Lots of people will tell you about this awesome course, then it's probably going to be a really good course. And I think in Australia, like CPD Junkie and the availability of what we have now is amazing, because heaps of people are talking about it, right? But sometimes do some investigation for yourself, and maybe that list that you make, this is what I can actually do. Short of becoming a specialist, this is what I'm prepared, the time I can put in, and then versus, my lifestyle is this, and so just if you know what you want to do, you'll find some courses.
So, everyone reaches a particular point in their life where they're kind of like, they're contemplating practice ownership, being a specialist, or being a super GP, Can you share your thoughts on that?
Yeah, I feel like I've hit this question multiple times, and I feel like it's the same time that everyone talks about, right? A few years out, and all of a sudden you're like, well, where am I going? What am I doing? And because
you're seeing your peers doing the same thing.
Yeah, that's right. So I think you also start getting that feeling of, I actually enjoy doing this, and that might be endo, or no, I'm joking. That might be, I'm a really great restorative dentist. I love resins and posterior, blah blah blah. You might love those things, and there will come that time where you say to yourself, do I want to be a specialist? But this time has happened for me probably about 3 or 4 times now, where I've gone, right, do I want to be a specialist? Then I do the primaries, this sort of stuff. And the most common thing that keeps coming back to me is, one of the things I love about my job is that, yes, I love children's dentistry. Yes, I love ortho, but I like crown preps. I like veneers. I still like doing some endo, one canal wonder. But it's sort of like, if you specialize, then you're kind of stuck with one particular part of dentistry and one demographic of dentistry. So, I honestly don't want to be seeing kids 18 patients a day for the rest of my life. I'll probably have a breakdown. But you come to that point of whether you want to specialize or not. And I think inherently that you want to be a specialist. You want to do that, but also it's 3 more years, right? So I think nothing can replace a specialist course and specialist training, but I think we've got some really great courses now as dentists you can be proud of and say, yeah, I'm not a specialist, but I really love what I'm doing, and this lets me do some more things, right? Practice ownership, well, it's funny because lots of people talk about it, and if we jump back to day one of dental assisting, I always had in the back of my head, I'm going to have a dental practice and it's going to run like this. The infection control is going to be the best, I'll tell the bloody no. And anyway, turns out that I went off it for a little bit. So I graduated from dental school and I'm like, bloody hell, there's so much to owning a practice. And so I had all this practice management experience. And then you get to that point where it wasn't long ago when I sort of, I worked for quite a big group of practices that are all owned, by the group. And I sort of approached the main man and I was like, look, I really want to do this again. And it happened, like it literally happened in a few months, literally like getting loaned, blah, blah, blah. But, the thing that I hear about a lot is when people get into practices and all of a sudden things go really sour and, it's not a great experience. Just do your homework first with owning a practice and what you want to achieve out of it. And then I guess you need to, the people you buy in with or the other co-owners need to be on the same planet as you. So it's a bit like when you first go, oh, I want to work in this practice because they do this and they're really great at this and you get a good feeling about it. I think, I sometimes just feel like I've sort of landed on my feet in all aspects of doing something that I really enjoy doing, getting to do the job I want to do, buying into a practice that I absolutely love, and I've got heaps of support and mentorship by the other owners. Do I want to specialize? No, I'm kind of actually pretty happy where I am, to be honest. Mm-hmm. If I was a specialist, I couldn't do what I'm doing right now. So, mm-hmm. And what I'm doing right now makes me happy, so stay where I am.
Yeah. Well, look, hey, that's why I bring up this question, because people go through their journey and they think about these things because, like I said, they see other peers doing it. And so they're making those progressions in life and they're thinking to themselves like, oh, what am I doing with my life? Like, how's this all kind of happening? So, I mean, before you're a practice ownership, you're at this group practice, but you're an associate, right?
Yeah.
And so and like you said, you've always had this idea that you might want to be a practice ownership at one point, but then when you graduate, you're like, nah, like I'm okay. And then you're working as an associate, and then you decide that, wait, actually I'm getting an inkling feeling that I want to, and then so you're kind of thinking to yourself, I'm just guessing here, are you thinking to yourself, oh, look, this is the kind of practice where you're working at right now, is like where you want to be and you kind of see your future in, and that's when you bring up that conversation? Is that what you're saying?
I think there's a couple of points to make for me personally, and one of those is ADA stuff and the original CPD I did of through Leadership Victoria. I love being a leader, and I really love that role of leading people and blah blah blah. So then when you get into a practice, when I sort of got up here, I was like still in the back of my mind, but then I thought it probably will never happen, right? I know I look 25, I'm not 25. But I felt like the time was right, because when you're in a place that you immensely trust the other owners like they're your family, and you've asked them questions and you've had conversations about it, and when you feel that gut instinct I was telling you about before, have the conversation. You're only having a conversation about it, right? But anyway, everything felt right, and it actually still feels right, and it's probably the best thing I've done. Like, to be honest, I think part of it was, coming up and being an associate, and you sort of moved out onto a practice where you're working by yourself most days in the week, so there's no other dentist there with you. Mm-hmm. And part of it came from that, because you're leading this team, right? All the auxiliary staff and other staff members are relying on you for answers to everything, right? And then I was like, I actually really enjoy being that person. So that sort of, again, re-inspired me to have the conversation and go for gold. And anyway.
Yeah, I mean, how does this all end up leading to the part where you're also now becoming the medical advisory committee of the private hospital, or this DIP practical practice management that you take up with New England?
Yeah, so the practice management was years ago before I did dentistry. So that was like to manage the peds practice I was working at, and the condition that I did that job was that I did that diploma to understand budgeting and all that sort of stuff. Medical advisory committee, I can't keep my hands out of it. So like that's why I was having a little bit of a break from ADA, but literally, working at the Brisbane Water Private Hospital, and so I do regular GA lists there, and children and adults, by the way, but I see quite a few special needs patients as well. But literally, you start getting, I've got sort of that bubbly personality where I just pretty much talk to anyone, quite happy to talk. And then, all of a sudden you become recruited to be part of their medical advisory team. And I was like, wow, this is new. Like, but the best part about that is learning about different aspects of the hospital. So there's all these doctors of different specialties there, and learning about some of the problems that happen in a hospital, and then budgeting restrictions and stuff within the hospital, and you're like, wow, and that's what dentistry brings here. And it's so I'm always happy to give something a go, and that's me.
So, of all the CPDs, what was a particular CPD that you would say was a game changer for you?
Oh, definitely. So the game changer would have been, ADA, vital ortho for dentists. Literally, that was the one that I really put my beginning bit of money into, and just went, right, if it's going to work, it's going to be this. And it actually ticked more than the boxes that I had there to tick. So it was me going, yeah, I really enjoy this. And I come home and I'm like, this was stuff I could start doing straight away, but it also taught me where to stop. Where's the next point that you would refer to a specialist? And, there's, it's always in the back of my mind, that GP orthodontist, debate that goes on. And I'm fortunate with local orthodontists that know I'm doing like ortho. And I think they sort of, are they happy? Don't know. But would they help me? Probably, yeah. So it's a good relationship. That was the pivotal one. So I'm not just saying that specific course, but it was that course that I sought to see whether that was what I wanted to do. So the equivalent might be a course in endo, or there's heaps of courses, but pick that course that's not going to be just a weekend warrior thing where you go, oh, I learned how much etch will affect the enamel, and it's got to be something that if you're really interested in, go find it. It's there. And then so that was the game changer when I actually went, yeah, that's an awesome course. I want to do more. Fortunately, in one of our practices, one of our other general dentists has been doing ortho for like 1.9 billion years. Kidding. But he's absolutely amazing. And I asked him to be my mentor, and, can I run cases by him? Absolute legend. And yes, he did. Great information, but also made me think about the replies and stuff. So that was the game changer CPD for me. Standout CPD is exactly what I'm doing now.
Yeah.
That particular course. And, there's possibly Australian ortho companies out there now, or, talking about, oh, you can do the Australian course. Oh, look, I probably will. So.
Yeah. One thing I was going to ask you is, how did you get the most out of your CP? But I think you've just mentioned it. You had that mentoring lined up with you to support you when you had these kind of cases after you had told the practice that you were going to dive into it.
Yeah, 100%. Like I think that the best part about the multi-practices I work in is it feels like most of the dentists have something that they're really passionate about or really like. For example, there'd be dentists that do lots of implants, endo, and so when you sort of put it out there, I really like treating children, or I'm really taking on some new ortho cases and, class on malocclusions, hit me with it. And these guys trust you immensely and will send you the work. So the most important part about that was I don't like biting off more than I can chew. And so knowing that I felt confident, but also having that mentor was hugely important. Because, otherwise, if I didn't have the mentor there, yeah, sure, you're doing the CPD and you're learning how to, there are so many things that can change in orthodontics, right? If you put the bracket on wrong, this is the outcome. So it's awesome having that other person there. So yes, I had lined it up, and that's how it came out.
Do you think there's any particular CPD that you feel like you didn't implement or was not as beneficial for you at the time and you would do differently next time?
I feel like, I've done a lot of CPD and sort of weekend sort of courses. As small as they are, they might be a pharmacology update or something like that. And I think that's still really important to be doing that stuff anyway, right? I think the one that I really had big things for was the ADFA course and doing anti-wrinkle injections and lip fillers and whatever. And only because I have Botox myself, so I was like, can I use this on myself? No, but literally, I really enjoyed that course, and I remember it being like, far out, this is the most different thing I've done in dentistry, and injecting someone in the face, cool. Like, I felt really positive about it when I walked out of there and came back to the practice, and that's a bit of a thing to sort of start up and get a reputation with, right? Because people getting lip fillers are very, very specific about the way they look. So, and I started doing it a little bit, and then my days were just too busy with the other stuff, and so trying to fit someone in for anti-wrinkle injections and lip fillers just sort of dwindled off. And then, of course, was that the regulator questions over whether dentists should be doing Botox and anti-wrinkle injections, and so I guess after that it sort of just died down for me a bit, and I really haven't got back to it. So I guess it's probably the one CPD that I haven't used to its full potential. Like, I could be doing more, but that's basically because I don't know really where we stand. I don't know that anybody does, but also I just don't have the time in my day to do it. So it's not that I didn't enjoy the course, and it's not that I didn't see any value in it. It was just more a few things happened with the regulation of it, and then also, I think if you're doing a lot of cosmetic dentistry and this forms a huge part of lip line and all this sort of stuff, you could make that work in practice. So I think that I don't think it was that I didn't enjoy the course and I didn't get anything out of it. I actually really enjoyed it. So cool, like different, but I just haven't been able to implement it, and I think that's probably the one.
Fair enough. So I heard Julia Roberts was one of the reasons why you got into dentistry, but who else has been pivotal in your career path and why?
I think there's a lot of people, and we were talking about this earlier, and there is a lot of pediatric dentists that I respect for so many reasons, and I guess this is working in emergency at the Children's Hospital Westmead and watching some seriously ill children walk through that door that have been in car accidents and whatever. These guys inspired me because I'm like, this is not dentistry, just putting a filling in. This is extracting teeth out of the skull of some child that's half their head's caved in from a bus hitting them. And so standout people, is Richard Widmer, Angus Cameron, Philippa Sawyer, as I said. She was like a brilliant, and still is a mentor to me. I still call her and ask her about cases. And that's in Sydney, and down in Melbourne, I worked at the Children's Hospital in Melbourne as well, as a dental assistant, and Nikki Kilpatrick, James Lucas. But there's also some really cool orthodontists there that sort of all inspire me with cleft lip and palate. So literally, Kit Chan, I don't know if you'll know her, but also one of our academic leads at La Trobe Uni, Robert Main. He was so passionate about ortho, and I feel like we had a really great undergraduate program in ortho anyway. So I feel like there was this undertow of, I don't know, tooth straightening from way back then. But these people, I think, are the people that inspire me. And the other person that inspires me is Ned Reston, the man on the Central Coast. Everybody knows him, but his confidence and leadership qualities and his help and trust and support, even with clinical dentistry, but also practice ownership. So, I know that stuff's not CPD, but you can't pay for that advice from someone.
No, you can't.
And so that was my comment as well, as well as paying all this money for CPD to learn and that sort of stuff. Sometimes you can't beat just going and watching a specialist or talking to a colleague and getting their opinion and help and advice. That's priceless. You can't put a price on that.
Yeah, that direct feedback. So like you said, there's always, not every day is going to be perfect, So can you tell us about any particular struggles that you've had in your CPD or dental journey so far that some of our viewers might not know about?
Yeah. Oh, well, Opera knows. No, I'm joking. I think very early on, one of the things was an incident with a patient that I was seeing my first year out, and things didn't go great, and ARPA knocking on the door, and that was the worst experience of my life in my first year as a graduate. really explaining myself. Was it all my fault? No, but it was a horrible experience. So that's a experience in itself. That's not a great experience. I guess every day you're making a mistake somehow to be able to learn, right? I guess some of the most common things for me is, not making that right decision about when to extract a primary tooth. Like when back, a couple of years back, I was like, oh yeah, we can do a pulpotomy, and then there's a recurring abscess. Well, was I trying my best? Yes, but also did I make the right decision at the time? Probably not. So, I take that as a failure and a criticism and stuff like that, but you're learning from it. Orthodontics, I think anyone that does ortho or even looks at ortho, you think, oh my gosh, the brackets are on and all this sort of stuff, and then it's upside down. Or it's, you put the arch wire in, and because the patient's like licking away, and then all of a sudden you put the arch wire in, they're not even left the building and the brackets off, and you're like, oh my God. So they're just the sort of things that happen to me.
If you don't mind me asking, I mean, can we talk about that period? Because it's your that period where you had the first year when you had APRA, going through that. It's first year, there's a lot of stress going on, and then you get stuck with the notice from APRA. Like, I can't imagine like the amount of panic, the stress that you're kind of going through. Like, can you talk to me how you kind of cope through all of that?
I literally felt sick, like my heart sank. You're still on a high from graduating from uni. For me especially, this is a bloody lifelong dream for me. And then I get there, and then the first year out, I'm like, I was doing a reline of a denture. And anyway, it just never satisfied the patient and it didn't work. But the under things that were happening with that denture, with a previous practitioner had been, exo add, and so this denture was never going to be a great denture anyway. So then I get logged at the end with, this is all my fault basically. But fortunately, with the practice support and the principal, we were able to work through it. And again, that's my point about why I feel so lucky that I had a really ethical dentist to help me get through my first and second year out. Because not to bring this up, but these are one of the reasons why I felt like I had some really good support. It was the worst time of my life, to be honest. Like, I could have actually just stopped doing this, and I probably would have been a lot happier if I stopped. And just going to work every day thinking that every patient you're doing anything for, and I'm even talking about a bloody fissure sealant or a scale and clean, I'm like, oh my God, you start thinking about it and overthinking it, and it's so consuming that it affects your sleep, because all you're thinking about in nighttime is like, what can happen? Can I be deregistered? Why isn't anyone, then it finally moves on to your professional indemnity insurance, and that's another headache in itself, because they're sort of just like, well, you know what, just pay them, and you're like, but so it was the toughest. I think it was up there with the toughest thing I've ever done. Like, it was, it all came back fine. I didn't have to pay any money, anything like that. But it was, by the time you get that APRA notification to the time it's investigated and all this and stuff, it's 8-9 weeks later. And as a new grad in your first year out, I'm not saying that it's any less than being 20 years out, but it affected everything I did. And so I was really, really shy to do anything after that.
Yeah.
So it affected me for a couple of years after that.
Yeah, because I think for a lot of new grads, they don't realize that it's not just it's a 1 day thing, like a 1 week thing. It's like a long period, like you're alluding to. It's like it goes on for 2 months or so before it becomes resolved. And it's, you're going home and it's kind of affecting, you're not thinking straight. Whereas as a clinician, you got to be, I'm doing this job right now. I got to be focused in on here, but you can't help but have this emotion.
You feel hopeless, and you feel like you can't do anything. And there was this guilt that I graduated from dental school, but felt like, I had all these competency, and then you come out and you're not competent. Like, it actually was really the worst feeling. And, you in that time, you're still talking to all your friends that you went to uni with, right? So you're like, shit, this really happened to me, and no one else is experiencing it. Just
exactly. Yeah.
It's your age guy. Like, it's just it was it was horrible. And the other thing too is to come home and talk to your partner and or other people about it outside of dentistry, have no idea what it feels like. No, oh, it'll be right. No, don't worry about them. Well, you know, I know that, but you know, when you're an ethical person, you can understand why the patient's made a complaint. It was a really horrible experience, and I would truly hope that I never have to go through it again. Probably will, don't know, but at least I've got some more experience and know that I'm not hopeless, and know that, you know, it took me a while to feel any kind of confidence in what I'm doing. So actually, you know, I've got this really great story, but my first and second year out, it was a bit of a tough year. Most days felt like I didn't know what I was doing. So I felt like I was back at first year dental school being asked to do a surgical extraction with 50. That's what I felt like. So, and crap. But anyway, the good news is life goes on and you start feeling better about yourself, and you just surround yourself with the people, you know, who you aspire to be like, and remember the reasons why you did things. And this is one person. And if nothing else, it got me better, I think, at, I've always been really good at note writing and making sure everything's in the notes. So I didn't have a problem with that stuff. But what it really helped me do was really make sure my verbal consent with a patient is clearly understood. Like, I don't think there's many patients that I talk to now that don't clearly understand what we're talking about. They know what they're... So without being exhaustive for like a 45-minute conversation about getting consent, right? So I think there were some really good things to take out of it for myself. Do I want to go through it again? No. But also, if you are going through it and this is happening to you, talk about it, because bottling it up to yourself is not a great way to be, and someone else will be going through it. You know, there's a couple of sites on Facebook. I can't think of the name of it.
The Mental Block?
Yeah, Mental Block. And what a great platform. Like, there's nothing to be ashamed of when you're feeling crap about what's going on. So, and there's someone's possibly done it in the past or done it before you. So love what you do, and I think that's what brings you back. But yeah, I hope that helps in some way. Like, yeah, this happened to me in my first year. I'm happy to talk about it anytime. I wouldn't wish it on anybody. It's just nuts.
Yeah. Thank you for sharing that. You know, because you know, maybe some of your friends probably didn't even know that you went through that. Like colleagues when you graduated, that probably didn't even know. Yeah.
Well, I think too, it's not something that you always want to broadcast either, because you know everyone's talking about this awesome job that they got, and you're like, oh cool, I got an APRA complaint, and now it's not something that you would broadcast at the time. And I'm more than happy to talk about it now. Honestly, what doesn't kill you makes you stronger. Right?
So we'll pivot a little bit. So let's talk about what your ideal clinical day kind of looks like, the type of procedures you might be getting up to.
My ideal, I think it's pretty much doing what I'm doing now, to be honest. I have a fairly busy day, like, to be honest. Like, it's not a bad problem to have. I know people are like, oh, shut up, Andrew. But I have a fairly busy day every day. And I think my ideal day would be having just a little bit more time for each patient. Because a lot of my days spent talking people through treatment as well, so I find it quite exhausting. So my ideal day would be seeing 6 patients a day and still getting paid the same amount of money, perhaps you know, dropping a day a week maybe, just to spend some time doing other things. My ideal day, still doing PED stuff, but also, you know, I'm looking forward possibly in the future to doing a bit of DSD work, like maybe doing the digital smile design course and some more OSA sort of stuff and TMD stuff. That sort of stuff interests me a little bit as well. So my ideal day is probably not that much different to what I'm doing now, to be honest.
Right. And so what you're doing now is just all kids in ortho? Is that what you're talking about?
That was the question. Right, sorry. God, I love talking about myself. No, so my typical day at the moment, it's sort of a mixture. I'd say probably 70% of my day is children, maybe about 80% of my day is children and ortho. And then the other 20% is grown-ups and crown preps, endo. So still doing all the other stuff as well, but probably in the amounts that I like. Like I would not enjoy doing 4 endos a day, for example. That would be like... for me. But I think that balance is still nice, because like I was saying, you know, it's one of the reasons why I don't want to be a specialist, is because I like the ability of seeing adults and having an adult conversation as well. So engaging with kids is one of my favorite things to do, but also that's quite exhausting. So like I was saying, you know, a whole day of children's dentistry, kudos to the pediatric dentist. I love working with them, but I couldn't do it 5 days a week. I probably do the same by now. But my ideal day is sort of balancing a little bit, actually. So
yeah. And, you know, as an associate, how would you suggest to them that if they want to get into the general anesthetic side of things, you know, how do they get themselves involved if they're going to decide they want to tackle more pediatric dentistry in more complex cases?
So I would say if general anesthetic treatment provided under general anesthetic, you need to be really, really organized and really confident, because one of the things that I talk about with the other practitioners actually is, you know, going into general anesthesia, it's very important keeping to time, but also you're sort of the last resort. So imagine doing like a surgical extraction on a grossly carious upper 7 or something, and stuff goes wrong. You're the last person, you're the only person there to sort it out, right? So you need to be relatively confident in what you're doing. I say if you want to do that sort of stuff and do children, treat children under general anesthetic, perhaps if it's something that you're really interested in, spend some time with a pediatric dentist, watch them, tell them that you're interested, because if you truly are, they're more than happy to have you come along, and you can actually learn so much, but that's how you get the confidence. You don't want to be going to GA, never having done it, and then providing like all this treatment. Everyone in GA, you know, looks at you very differently, like you're a dental surgeon and you're, you know, oh yes, doctor, and you know, this stuff that you never really experience in a dental surgery. And there's more of an expectation of you as well. So I think if it's something that you're interested in doing, 100%, it's very rewarding, really love it. No one talks to you. Yeah, mouth props in, off you go. But I would say if that's something that you're thinking that you want to do, it's not something that you can just go, oh, I'm going to do that tomorrow. You know, you need to get, you know, into a hospital, and you need to do all the accreditation stuff to get in there. You need to find an anaesthetist you can work with. But also, you need to be quite confident. So if it's something that you think about doing, you know, and you don't know who to contact, email me. Like, I'm sure my email is there. I'm more than happy to find someone like a pediatric dentist. You probably know them anyway, but they are all so lovely and will let you go and watch. You know, they'll encourage you and help you to set it up. So you never know. If you worked in the same place as them, taking kids there, they might already have it there for you. It's quite expensive to set up in there, like a mobile dental trolley, an x-ray machine, consumables, equipment. It's fairly expensive. But, you know, I think if you really want to do it, like we're talking about with CPD, if it's something you really want to do, do the homework, find exactly what it is you want and what parts of that you like. One of those things might be going, I'm going to call the pediatric dentist and go and spend a day in GA with them. It might turn you completely off as well. So do the homework first, find somebody. That's what I say.
Definitely. So, do you have any, just to wrap it all up, is there any words of wisdom you want to give to the budding young dentist?
Oh, yeah, I literally just love what you do. You spend so much time at uni and grueling time at uni, right? So you get out and you're able to practice dentistry. Just love it. Don't make it be that consuming thing. You don't have to be the best. You don't have to, you know, I don't know, you know, do a full mouth oral rehabilitation in week 1. What you do need to do is crawl before you can walk, right? Be good at the things you've learned and the things that you can be good at, and then you'll learn about what it is that you really want to do. If you're struggling to find what it is that you want to do, let time be the decider. You'll eventually decide what you want to do. That might be public health dentistry, it might be research, but my advice is don't feel that, which I think it's hard with social media, right? But I think don't feel like you've got to walk out of uni and be the absolute best of the best. Spend some time finding a good mentor. I know that's hard to actually balance with trying to find a job, but if you can find someone that you can work with that looks at your work and gives you constructive criticism, take on the criticism, right? It's not a bad thing because we all learn from it. So that would be my thing. I think just try and love it. Love it for what it is and enjoy the fact that you're starting to earn a little bit of money and you can, I don't know, go out for dinner and, I don't know, do those things, but also find some personal time for yourself. That's what I think.
I mean, I do want to say one thing is that it's interesting that you say that because, like you said, when you graduated, you're a mature student graduating, and even then, you're still saying, look, guys, you just need to slow it down, just take it slowly, and sometimes it is that time. But it's interesting because you say that because, like I said, you're a mature student, so it's interesting that you don't feel pressured to rush because a lot of graduates now, they are postgrads and undergraduates, so they've either had 3-4 years under their belt before they graduate, and they're like, oh man, like these kids are graduating and they're only 23 and I'm like 25, 27, like,
yeah. I do feel like as the mature age student, there was some need for me to, I don't know, get out and be awesome. I don't know. But it's soon, I just keep it real, right? Don't feel like you've got to do those things. And maybe that's someone at your graduation ceremony telling you, don't feel you need to be, just go slow. There was a little bit of a hurry for me, like given my age of graduation and all these bills piling up in my private life. And I was in a little bit of a rush to see patients, I guess. My advice is don't rush it, but also from the very beginning, like I know there's all these things. I want to be the best at this. I want to be really good at this. My prime advice is to learn from the very start how to balance it, right? So you work 5 days a week or 6 days a week or whatever you're working, but that's your personal time there. Don't spend so much of your personal time still thinking about work and CPD stuff. Make it work for you, but find the quiet time in your head to actually do something that you like, because if you spend so much time doing this, you have absolutely no balance over here. And I don't like saying that work-life balancing because it doesn't gel with me, but I'm just saying have a balance. So what's more important to me, and my clear advice is make sure you still have a bit of this balance here to balance out the hard stuff. You'll get there. You've got a lifetime, right? You got how many years are you going to spend doing dentistry? You've got heaps of time to get there. What's the race? I remember people getting their assignments done at uni, and there was never a big race. So don't sweat it. You'll get there. Like it's taken me years to sit here and go, this is what I really enjoy doing. So
Yeah, definitely. Well, Dr. Andrew Sproll, thank you for coming on the show today. If you could let the people know how they can find you or what's kind of going on in your life.
Sorry, say that again.
How they can find you or what you've got going on in your life.
People can find me on social media, probably being annoying. I say that I'm on the Central Coast, but I'm always happy if you send me if you want to know something. I don't whatever it is you want to know. I'm on Instagram, Facebook. Contact me anytime. Add me as a friend. Say something funny. I don't know. I love interacting. So anytime. Well, as I said, if you want some advice on like GA stuff, not that I'm quite happy to point you in the right direction if I can help you. So, but it'd be good to chat to anyone anytime. So yeah. Otherwise, you'll find me on the Central Coast.
We'll definitely leave it in the show notes for the people to find. So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie podcast. Thank you.
Thank you.